So welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Audit Committee. Today's meeting is officially called to order. Please note for the record, committee members Sally Hernandez Piñero and Anita Kawatra are participating virtually in a listening capacity only, and Dr. Allen is representing Dr. Katz uh, in a voting capacity. I would like to propose a motion to adopt the minutes of the Audit Committee meeting held on December 4th, 2023. Dr. Allen?
Yes.
Frida Wan?
Yes.
Jose Pagan, yes. So I move to enter into an executive session to discuss confidential and privileged matters that may be related to threatened and potential litigation. All in favor, please say yes.
Yes.
Opposed, say no. So let's go to executive session.
affiliation. So I am taking myself off of it just to see any favoritism.
Very understandable.
Unmuted.
Okay, so we're back from executive session. Now we'll have an audit update from Mr. O'Keefe.
Yes. Okay. The first two items we have are external audits that are being done by the City Comptroller's Office. Both are around mental health services. They've been ongoing for a while now. They are both caught up in the same situation, which is access to PHI and working around that obstacle. The next item is number of audits we have. Sorry, I don't want to go through this too quickly. We have 14 audits on the plan, 5 of them are completed, 6 are in progress, 3 haven't been started yet. The next item we have is on system-wide review of nurse hiring. This audit's been ongoing. We completed this audit. The report should be coming out shortly at some point. And the next item is patient belongings, patient valuables audit. That's one of the series of audits. This one took place at Kings County. We completed it. There were very similar findings to the previous audits. We are working with a committee of various people to try to implement some of the improvements that were in the report. Nobody has any questions. The last thing we have is on auxiliary audits. They're ongoing at this point. We're coming close to the end point in some of these audits. Most of them are just a matter of the accounting firm getting information from the individual auxiliaries. And that would be the end of my report. If anybody has any questions.
Sally? I mean,
I would be Sally, but Sally's not here, so I'm channeling Sally. I just have 2 quick questions.
Yes.
So on the patient valuables update, it says that it could be improved in updating. I think you mentioned you're working with
various members of IT and the local staff to try to update the process. Currently, a lot of it's done manually,
Right.
where they keep a listing of everything somebody brings in. We're trying to automate the process and have an inventory process.
Right.
It's the back end part of it that's not as automated as it probably should be. Sometimes they have problem finding things. They have warehouses full.
And this is similar. You've done a couple audits.
Yeah,
of
we've
other
done.
hospitals. It's all similar findings.
It's similar findings because they all use similar systems.
Right. So I guess this is my question. I mean, it seems like it's a system-wide solution. Is
Yes.
that possible? Like, is everyone working together?
Yes, we're looking
to...
at something with IT and others that would be a system-wide solution that could be implemented at all the acute care facilities.
Right.
To track things.
Okay. And then, because it feels like we might as well just try to get this in place everywhere, because we're going to keep finding the same.
We only did it at a few facilities because we kept running into the same problems, and then it seems like it's a problem across the board, so we really didn't need to audit everyone to find out the same problems.
Right.
And that's why we are working, because there's been, over the years, some improvements to the front end through Epic where they can track it, but then it's on the back end, there's no inventory of it. Mm-hmm. So if they go in, they really have to walk through the room hoping they find whatever's on the shelf somewhere.
Right.
Which can be a problem. That's why we're hoping to get it automated to
Yeah.
some point where they can just look it up, find it, and be able to get back, because it is a patient satisfaction and other
Right.
issue if we don't return their belongings to them.
Yep.
So when do we find out the specifics of tracking people's belongings, their phones, their teeth, et cetera, things that tend to get lost? Is there a specific system that's being put in place? And when does that get fed back?
Well, some of that is tracked in terms of if there is a patient complaint, if they're missing things, they do track some of that. And they have to file actually with the city if they lost something to get paid back. The health system itself does not handle that. But we are looking to get reports from the city that would show us exactly what complaints that were made, because we don't always necessarily know if the patient made a claim on missing items.
But we do know internally, because I've seen reports
Yes.
from the different facilities. Do we know a return rate? So if we have 100 patients say they lost their property, what percentage of those patients actually get their property returned? And who would tell us that? Hospital police? Who would know that? Because I think that,
it's a metric that we track, to my knowledge.
Hospital police would know certain aspects of it. I haven't seen a report that showed exactly there was 100 items, 2 patients had missing items.
So in your audit,
In our audit,
you
we-
did not.
No.
because this is, to your point, every hospital has this. They come in the emergency room, they get admitted, and they go home, and where's my phone? Where are my teeth? And I don't know if since it's come to your committee, it's a significant problem if we're being audited.
And we didn't.
I think we should probably think about getting the feedback and finding out, because we don't want to get audited all the time, year after year for the same problem. How do we know if we've improved?
And is there a financial impact in the sense you said?
That's what we're trying to determine, because the system does not get a report back from the city on exactly the claims that were paid currently. From what we're aware of, there's no report that actually comes back because we have asked for it. So we have no idea if a patient actually makes a claim from the city, whether that claim gets paid or not.
I see.
So we don't actually know the actual loss to the system as a whole, or if it even is a loss to the city and who's actually paying
To your
that.
point, there's 2 points. One is the financial impact, but also patient satisfaction.
satisfaction.
So having the information, to Michelle's point, on what is.
But I appreciate what Mr. O'Keefe is saying, that the results of the audit, we know what we're doing, but you don't get feedback from the city in
Yes.
terms of the patient's claim being satisfied or not. I think the internal discussion is probably not for you. It's for us to take to another venue internally. So thank you for the report. I appreciate it.
Thank you. Okay,
One other question. The completed audit, you may have mentioned, you have here the objective of the audit, but were there findings that you would summarize? The nurse system?
Findings are handled. You should have received some of the reports
Oh,
in an email this week.
okay. Of the nurse hiring?
Not nurse hiring, that has not gone out yet. That should be going out next week.
Okay, perfect. Thank you.
thank you. So let me move on to the next item, which is a compliance update from Catherine Patsos.
Good morning, everyone. So I'm going to go through some of the activities that the Office of Corporate Compliance has been engaged in since the last meeting. The first one is the fiscal year 2025 risk assessment. I mentioned this in the previous meeting, and since then, my office, the Office of Corporate Compliance, has reviewed oversight agency guidance and their work plans to find out what they are looking at, as well as we've looked at our previous audits that were done by oversight agencies to see where if we might have still some vulnerability there. And the OCC, in conjunction with internal audits, we've prepared the draft FY 2025 risk assessment to present to the Enterprise Risk and Compliance Committee later this month. The Coal Fire 2024 risk analysis has begun. They're doing document production interviews for the acute care facilities this month, and they'll do the neighborhood health clinics. It will begin in March. We are developing a policy management system. The compliance and EITS are working together that will allow us to draft and revise new and existing policies and procedures throughout the system. It will automate the review and approval process as well as the distribution of the policies to the intended audiences. They're working right now on the operating procedure portion of it, but it will be expanded to include other resource documents like guidance and administrative materials and tip sheets. Every year, at the beginning of every year, I meet with the program and facility CEOs to bring them up to date on what's been happening in compliance, as well as review their coal fire compliance and risk reports, any upcoming operating procedures that are new or revised. We also talk about what has been happening in the OCC, including the policy management system, the workforce member compliance survey, and the risk assessment that they all participated in. And also we review their compliance and HIPAA training completion rates. As far as the compliance and HIPAA trainings this year, because the Office of the Medicaid Inspector General has expanded their training topics that need to be included in our general compliance training, we have separated out the HIPAA training into its own module and are putting the compliance training into 2 separate modules. And one is around fraud, waste, and abuse and payer requirements, and the other is around code of conduct and disciplinary standards. And here we have the completion rates as of December 29th for the general compliance and HIPAA training in 2023. We have done better overall, and the individual facilities did a really nice push toward the end of the year to encourage their staff to complete the training. So we went from 85% to 88% completion rate. We did a workforce member compliance survey in December, like we did last year. Unfortunately, the response rate was not as good as last year, so we're going to be marketing it better when we do it in 2024. We are tabulating the results. However, some of the high-level findings is that there was an increase in the percentage of respondents who knew how to contact the Office of Corporate Compliance and their compliance officers. As last year, the supervisors and managers are the likely first point of contacts that staff bring compliance issues to. Most of the respondents thought that the training provided good guidance on how to act appropriately and that they did recall key lessons from the training. And more than half of them would like to see more electronic communications from the Office of Corporate Compliance, which we will be doing. Next, we have the compliance report metrics. We have the past 2 years on the compliance issues have been about the same, 302 and 305. And in the next slide are the time that it has taken to resolve the compliance cases, which has reduced dramatically over the past 3 years.
What would you attribute that to, Catherine?
I think it's attributed to just a more efficient means of streamlining the cases and making sure that they get directed into the appropriate place if they're not compliance issues. And also, I think that the staff are just better at closing the cases.
Mm-hmm.
Yeah.
Right. And it's not so much the nature of the cases.
And I think the nature of the case has been pretty steady, except for the privacy cases, which I'll get to in a minute. Those have increased quite a bit. So here we have quite an increase in the privacy cases. This is due to a number of factors. We've discovered different ways of identifying inappropriate access to patient records through various means, including a patient privacy monitoring tool that we use.
So are you saying that the increase in the private?
We've been able to identify more cases when there has been inappropriate access to patient.
So it may not be that there's more incidents, it's that you are able to
Exactly.
identify them more.
Yes, we're able to identify them more, correct. And the next slide, finally, as with the compliance cases, we have reduced the number of days it takes to resolve the privacy cases as well. And that concludes my report.
I guess just, sorry, to follow up again on the, it's pretty dramatic increase in the privacy cases over the last 2-3 years, I guess.
Yeah.
And it sounds like you're saying it's more that we're identifying them, or you don't think there's like a training issue or a procedure process issue that's causing.
Folks did a lot of focused training on HIPAA and privacy, and really honed in on some key areas where we have found the inappropriate access and tried to address it more directly to try to bring those cases down. And also, I think that doing the HIPAA training separately, where we can really focus more on some of the HIPAA requirements and do's and don'ts and examples, is going to hopefully reduce the incidence of the privacy cases.
Thank you.
Thank you
Any other
for the
questions?
update. I had a quick question connected to the policy management system.
Mhm.
So is that you're implementing a new platform so that if I know that I have to review a policy,
You'll,
by a certain date, I'll be
yes, you'll
sort
be
of like
prompted,
flagged or
because
prompted.
the tool will have the review cadence included in it, so that you will be reminded of when review of one of your policies is coming due.
And right now, the system we have is more static.
It's just manual.
It's just, yeah.
It's a manual process, and we have operating procedures that are very, very old and need revision and updating. And so I'm hoping that this tool will facilitate that and make it easier for people, for policy owners to update their policies.
Thank you. Any other questions?
And it will be searchable too, across the whole spectrum of policy.
Is there a regular kind of timetable that policies should be reviewed, like every
It's-
5 years or every?
It's typically it's less.
Every
Fewer
two.
than, yeah, every 1 or 2 years,
2 years.
maybe 3 at the most, I think.
But some are very old, so they haven't been,
Like the
Yes.
owner and,
right.
Yes, very, very old.
okay, great. Is there any old or new business to come before the committee? There be no further discussion. The meeting is adjourned. Thank you so much.
Thank you.
Thank you. Thank you.
This meeting is no longer being